A very warm Abunda Life greeting. This is Robert H. Sorge, Doctor of Naturopathic Medicine since 1964. Naturopathic medicine, which includes detoxification, nutrition, fitness, and bioidentical hormone restoration, being a viable alternative to orthodox drug medicine, has been a very popular discussion recently. Some may ask exactly what is naturopathic medicine. At Abunda Life, it's a drug-free form of medicine that encompasses our whole being, body, mind, and spirit. A foundational principle of the practice, of our practice at Abunda Life, is we believe that God is our healer and our health giver, and that He designed the human body in such a way to heal itself without pharmaceuticals. At Abunda Life, our form of naturopathic medicine is first of all a philosophy. Our natural healing philosophy encompasses our whole being, body, mind, and spirit. Our health-enhancing philosophy gives us our motivation, our direction, and the discipline necessary for the accomplishment of high-level wellness that we were designed by our Creator for. This philosophy has proven itself over the centuries to be the most effective form of medicine in the history of the entire world. This form of medicine is different from orthodox drug medicine, which treats disease after it has gained its foothold. This form of natural medicine does not treat disease. Rather, it treats you, the individual. We are looking for the bottom line cause, the imbalances, the blockages, the toxicity, and the nutritional deficiencies that has caused the problem in the first place. The idea of treating you, the individual, rather than a named medical condition, seeking and addressing cause rather than suppressing symptoms with a drug, may sound novel, unique, and even new, but it's not. This form of holistic body-mind-spirit medicine goes way back in human history to Hippocrates and before. Known today, Hippocrates is known today as the father of modern-day medicine. 2,500 years ago, Hippocrates taught in all his medical schools in the ancient Greek Empire, let your food be your medicine, and let your medicine be your food. This is the father of what is called modern-day medicine. This ancient but basic health principle of Father Hippocrates has long been forgotten by today's orthodox drug medicine doctors. Establishment doctors are taught little to nothing about nutrition, healing foods, or natural food supplements, but much about deleterious chemical substances that treat disease symptoms by suppressing them, often causing more problems than the original problem itself. What I've learned in over a half century is the vast majority of people are basically lazy when it comes to taking care of their health. They're not willing to change. What this means is that most people do not qualify for this type of medicine. In a sense, it's for the elite thinking people, not for the great masses. In short, naturopathic medicine is not for everyone. I've got to tell you this up front. In many ways, it's basically contrary to the practice of what is thought of as medicine and the American Medical Association, and maybe even your own family doctor. So, up front, this may not be for you. At this point in my life, I'm not going to attempt to convince you of anything. If you're satisfied with it, with the type of results that you're getting at this moment, you need to stick to what you're doing. If you're satisfied with your drug medicine doctor, stay right with him. And we're telling you to stay right with him anyway, even if you choose to go through our process. To help you determine for yourself if this form of medicine, this alternative medicine, even makes sense for you, I want to ask you 10 quick questions, and then the answer to the questions will pretty well help you to determine this for yourself. 1, do you have some type of health issue that's simply not going away? Do you feel that you may be going backwards? Or in short, are you slipping? 2, are you feeling, looking, and even acting older than you should? 3, do you have digestive problems such as bloating, gas, flatulence, constipation, which we define in our form of medicine less than having a bowel movement for each meal that you eat, or less than 3 bowel movements a day? 4, are you more tired than you should be, fatigued, running on empty, out of gas mentally and physically? 5, have you put on some ugly fat or flap and misery, all in the wrong places? Possibly your clothes are getting a little tighter than they should be. Buttons popping, zippers won't zip. 6, are you losing your zest for life, your ambition, your get up and go? And most importantly, how is your libido? Muscles, 7, muscles, joints. Do you have aches and pains, weakness, cramping, spasms, stiffness, immobility? Are they getting worse? 8, have you been a little bit more forgetful, moody, touchy, or negative, or even a little depressed? 9, are you having sleep problems, slow healing, taking longer to recuperate, immune system not working as it used to? 10, lastly, are you on any medication for diabetes, blood pressure, cholesterol, triglycerides, but feeling worse? Or is it possible you're feeling half dead and the doctor says you're perfectly healthy and your problem is all in your head? Did he prescribe an antidepressant or some other form of la-la land drug for you? If your answer is yes to some of these questions, and you're honestly and truly, genuinely sincere about doing something about them and changing your life, then the Abunda Life system of body, mind, spirit, medicine, naturopathic form of medicine may be able to be of help to you. So how do we get started in this form of health and nutritional medicine? There are many different holistic services that we offer at Abunda Life, but everything starts with the evaluation. Back to Father Hippocrates, who taught in all his medical schools that a proper health evaluation represents half the cure. Anything less is treating your body as a toy and is irresponsible. At Abunda Life, we call this nutrition testing and personal health evaluation. It's where everything starts. It makes sense. It is indeed the starting point of all achievement as far as your health is concerned. Nutrition testing and personal health evaluation is a highly specialized service, not available at your family doctor's office, clinic, or local hospitals. It's a different type of testing for a different purpose. It's not unusual for a blood test to come back and for you to be told by your doctor that the test came back normal, or you're perfectly healthy, or the problem's all in your head, and you're at the same time walking around feeling half alive and half dead. This phenomena happens every single day in mainstream medicine. How is this possible? What is the reason, you ask? Well, there is a difference between pathology and functionality. Pathology deals with disease. Functionality addresses health, holism, nutrition, and even high-level wellness. The purpose of our medical evaluation, at least the one that people are used to, is to diagnose a dis-ease. The purpose of functionality is to improve your state of health, to get better and better and better. Not being able to confirm clearly a full-blown disease, in my opinion, does not mean that you're well or that you're healthy. There is a huge gap between sickness and high-level wellness. There are many, many pre-diseases and in-between states that fall short of a full-name, full-blown medical disease. The best analogy I can give you is some people can run a mile in under 4 minutes. There are humans that can do this. Others can't walk around the block. What is the criteria for wellness? Medical doctors are trained in pathology. They are, in fact, experts in that area of life. From the disease, the diagnoses, to hospice, to death. At Abunda Life, we believe that sickness is abnormal and that high-level wellness of body, mind, and spirit is normal and the design of our Creator. In other words, this is the way you're supposed to be. We also believe that every symptom is a sign of a nutritional deficiency, and every named medical condition is connected to a long-term nutritional deficiency that has either not been addressed or worse, suppressed with a drug. The wisest man who ever lived, King Solomon, wrote 3,500 years ago that there is a time and a place for everything under the sun. If you are having a heart attack, a stroke, or other life-threatening named medical condition, please do not come to me for carrot juice or fitness or any of the services that we perform. Don't come to me for vitamins when you're having a heart attack. Please use your common sense. What are the benefits of nutrition testing and personal health evaluation? There are thousands of benefits. I'm just going to review just some of them. First of all, you have the right to know as an American citizen that what is the functional and nutritional status of every system of your body. Most people go their entire lifetime never knowing what their optimum, preventative, and perfect numbers should be on a blood test. What nutritional deficiencies, imbalances, toxicity, pre-disease states that they are simply living with. Only when you get the diagnoses, only when disease has already gained a foothold, do you learn these things. Abunda Life's evaluation is an incredibly valuable education tool. Learn what organ systems of your body are toxic or underperforming. Learn what systems of your body are strong and which ones need special nutritional support. Learn what foods are compatible and not compatible. Is toxicity overwhelming your immune system? So many people are being drugged when they really should be detoxified. And believe it or not, the medical schools do not teach naturopathic detoxification. They do not teach nutritional supplementation. They do not teach the very basics of what we call naturopathic medicine. It's not until the disease gets its foothold that they begin on their treatments, and then those treatments are usually toxic treatments or worse.